Okay.
When you have a fever, go to the nearest health facility, get tested, demand to be tested. Not all fevers are malaria.
Zero malaria starts with you and me. So let's take action.
Hello and welcome. It's World Malaria Day today, and it's not something you should really celebrate. I know, because malaria is not something very friendly. But if you know that Nigeria has got 27% of the global cases of malaria, is that something you should celebrate? I know it's not. And this is why we're here on World Malaria Day to tell you about the things that are available to reduce the incidences of malaria or the cases of malaria. Nigeria shouldn't carry that bad name. And that's why we have in the studio two guests from an NGO that is doing great work in terms of provision of malaria kits and all of that in public health centers in the Federal Capital Territory. My name is Odo Diego Kenedo, and I would like to welcome you to Akweya TV and also welcome our guests to the studio. I have with me Chinyere Okolo. Yeah, you're most welcome.
Thank you.
Yeah, you are the
Community System Strengthening Manager for Pancreas Healthcare Initiative.
all right, you're most welcome.
Thank
And
you.
then Augustine Firima.
Yeah, I'm Dr. Augustine Firima.
Yeah.
I'm the clinical consultant for Pancreas Healthcare Initiative.
Okay. So malaria, why do we still have malaria as a problem despite having the many years of investment that Nigeria is having and has put into it?
Yeah, thank you. So malaria is, we all know, is a public health menace, and it's something that for us to have meaningful impact, all hands needs to be on deck. Not to bore us with so many scientific discussions, but let's know that as humans, we strive to adapt.
Yeah.
Even in the harshest conditions, we try to adapt. That's how these parasites also try to adapt. So as humans are devising one means of eliminating them, they are adapting or devising several other means of scaling through those targets that have been done. So I think one way we can look at it is, as humans, we have our own part to play. And for us to win the fight against malaria, everyone needs to know what their responsibilities are. One of the things that is marring the current efforts that the global world and even Nigeria, the Nigerian government is doing, is that at the community level, people are not yet well sensitized about what they can do to drive down the burden. I give an instance. We have been saying that we need to test and confirm that there is malaria before you go ahead to treat.
Yeah.
Where someone who has fever, which is a classical symptom of malaria, and we know that it's not all fevers that are malaria, right?
There's Lassa.
So there's Lassa fever and the other, we know COVID, right? So assuming I have a fever and I assume, oh, this fever is malaria, I go over the counter and get malaria drugs.
Yeah.
What I'm doing to myself and the entire system is that I'm exposing these known treatments, right, to resistance.
Yeah.
So the next time I have a real fever that is due to malaria, I'm going to take these same drugs that I've exposed to resistance, and I'm complaining that it's not working. So you see that my inaction, action or inaction, by not doing the right thing when I had the fever, which is exposing every other person to danger. So as much as the government tries to put in effort to combat it, we also as individuals have our own role to play to abide by what is required. That way, concerted efforts will help us achieve faster elimination.
Okay, so there's a behavioral component to this issue. Chinyere, I know also there's that behavioral component to things like long-lasting
Insecticide
what have you noticed in the field of Farmpriest healthcare, especially when it comes to using the nets?
Okay, so usually the challenge is, it's not in owning the nets. I mean, if we go to the community and we say we have 5,000 nets to distribute, we won't have a challenge in distributing those nets.
And some people
There would
use
always
it for
be people
fishing.
to collect, yes. So, but the challenge now is in this behavior thing you talked about, because we've seen instances where people are using the nets on their farms to cultivate tomatoes. Some others are using it for fishing.
Yeah.
They would use it for everything aside what it is actually meant for, which is to sleep. Which is actually to sleep, ensure that you sleep inside it every night, because that's how you prevent malaria, using the insecticide treated nets. And even especially for the vulnerable population, which is the pregnant women and the under 5 children. So those are the behavioral issues that we see. When, as it relates to insecticide treated nets.
I personally have an issue. I think when I enter under the net, in the net, I feel choked somehow. Is that really the problem others to complain of?
Okay, so yes, we've encountered people coming up with such concerns, but I think the big question there is it better you inconvenience yourself for that 1 minute if you feel inconvenienced?
1 minute.
Well, like that's just that space of time and prevents malaria. And prevent malaria. Or is it better to not ditch the net and then run the risk of getting malaria? So, and I also think it's in the mind also. We let people understand that once you have ventilation, your sleeping area is well ventilated, then that concern can be taken care of. So it's in the mind, it's in us, consciously trying to take that action. Everybody has to take action when it comes to malaria prevention.
But just to add on this, I think also it's really a valid concern, right? And there's a way that information needs to go out to the people so that they manage expectations. One of the major reasons is that, at first use, the net is supposed to be hung in a shade. A shade, under a shade for at least 24 hours. So that those chemicals are easily diffused, so the concentration is not much at first use. So users of the net need to expect that at first use, they may experience that choking sensation. It's a valid concern. But as you continue to use it, it tapers out without losing its protective effects. So once they have that, they know that this is a possible expectation they will have, they are likely to know that, okay, I can manage it for this first period. And as it tapers out, they are now more comfortable using the nets.
People are using things like, there are some leaves they beat the walls with, and then it just chases the mosquitoes away. Have we tried are you aware of studies that work on those things?
Well, I would say that I'm aware of leaves that chase, but I know that they could be herbs or plants that have repellent effects. So because they have repellent effects, the presence of those plants can actually drive away mosquitoes for a period. So it's not like the definitive protective measure that anyone should bank on. Even the common sprays that we use, we go to the market, we buy shelters and all those bits.
And mosquito coil. So they nearly killed us young.
So most of those things have that repellent effect. Some of them have what we call the knockdown effect. So for the period when the mosquitoes are exposed to those things, they are knocked down. And after a while, how long do they stay knocked down? Right? After a while, they can easily come back. But for us, what we want to know is, besides the knockdown effect, besides the repellent effect, are these things killing the mosquitoes? So when it knocks it down, does the mosquito die? Such that I don't have to worry about that mosquito coming to give me another infective bite. So because of all these, we are not, those plants may exist, but we cannot vouch 100% to say that this can give you full protection.
Chinye, does sanitation work? Why are we not emphasizing sanitation enough? Because we go to these communities, talk to people, give them products, but we see stagnant water everywhere and grass is not cut. Isn't sanitation supposed to be a key part of what we should be talking about as Nigerians? In any case, it will solve many other
issues. Yes. Actually, sanitation is a key thing to environmental control measures, and is also part of the key messages we have for the communities. Getting rid of stagnant waters, bushes, shrubs around the environment, of course, actually takes care of the mosquitoes too. So in addition to all other intervention, this is also an addition, something that also works. So definitely sanitation works, and for us in Farm Chris, it's part of our key messages. It's integrated in the key messages that we're passing on to community members. Okay.
What of manpower? Do you have enough medical? They say all our people don't jackpot, all our medical personnel, all the good hands have jackpot. Are you having that challenge in the work you do? Good hands, either in healthcare or in communication or in, community work?
Well, what I can say is that resources are never enough. And even in the midst of the very limited we have, like you are saying, the Japa syndrome, we are also often having a more depletion of the current status. So I would say that, resources, we need more resources, both human resources and other resources. But however, we could do better with what we currently have. So at the community level, we have people at the community level, like I was just saying earlier, malaria is everybody's business. Malaria prevention is everybody's business. I will not leave my house as a chief to come and clean your own environment for you, right? So do you need extra human resources to keep your environment clean? The answer is no. Even if I'm the only one in my house, I do not need a maid, for instance, to come and keep my house clean when I'm fully capable, unless I'm incapacitated in one way or the other. So what I think is that with what we currently have at the community level, we could actually do better, right? With regards to pooling resources for malaria control. At the health facility level, that's where it's a bit tricky, right? Because with the current situation, we are seeing depletion of human resources at the health facility level. We are having the little that are on ground burdened with so many other tasks. So imagine a health facility where we have just one staff who is supposed to see the patients, who is supposed to give health talk, who is supposed to document medical records and do even management, it starts with the management responsibility of that health facility. You can imagine that that person may not give 100% to all these tasks. Then becomes burdensome on that person to do something that is quality.
Is it a problem of our poor management of resources? And I ask this question now because of I used to advocate that all the schools of health technology, health nursing, and all of that, the students come out without experience. While if they have been deployed, either as part of their IT or even their regular learning, going into the field, there could be the part of the hands that will be performing some of these roles. Don't you think so?
No, I agree with you to some extent, because you see that, so I finished from a school where ideally I should have one microscope to myself for practicals. But you see where no, I would rather leave that.
Okay.
So you see that you have a system where maybe 15 to 20 medical students will be scrambling over one microscope to just have a view of so you can imagine that at the end of that lecture, out of the 20 persons that are assigned to one microscope, it may just be one or two that may get the full grip of what has been taught.
And be telling others what I saw.
So you face the same situation at the health facility. So even if we have in the School of Health Tech, even if we have people enrolled in those schools, They actually have their community postings. So it's not like it's non-existent. They, at some levels in their curriculum, they go to the health facilities for practical hands-on sessions.
Yeah.
But the challenge is when they go to those health facilities for the hands-on sessions, is the capacity at the health facility enough? So it becomes that case of me having microscope to 20 people.
Yeah.
That person at the health facility is doing immunization. That person in the health facility is doing so many other things. So what time does that person have to transfer adequate skills to these students that are coming to learn? So you see that a gap in one aspect affects the other aspect, and it becomes a vicious circle.
Okay. And so now let's come to Farm Chris. You are running a project where you're providing certain free malaria
treatment.
Test and treatment.
Yes.
Whoa, tell us about it then.
Okay, so we have
yeah, making me wish like I should have malaria, but I wouldn't.
No, so Farm Chris, with some funding supports from Islamic Development Bank, is providing free malaria tests and treatment in all public health facilities in FCT. So basically, when people go to the facilities from the communities, they go to the facilities. If you have fever, the first point of call is where you get
Tested.
You get tested. So, and that testing for malaria is free.
Okay.
And if it turns out that the person is positive, they also get the anti-malaria for free.
Okay.
Yes. So we are using this opportunity to encourage people to go, because most times the challenge is they may not be aware that these services are available in those facilities. And so you have a situation where people would rather go and buy drugs in the communities rather than actually go to the facilities to access these free services.
We've also seen instances where certain services are supposed to be free, but the health facility will say they are charging a small fee for administration, maybe administrative convenience. Maybe they need to keep a generator running. Are you providing that whole something to ensure that it's free?
Okay, maybe I should just come in. The thing about administrative fee is that the organization, the health facilities must run because they don't have all the resources that they need for themselves. Yeah. So for Farm Chris, the scope remains to get these commodities, both the testing kits and the anti-malarials, free of charge. However, people utilizing the health facilities need to know that when you go to a health facility, you need to have a medical record, right? You need to have a folder where your details are captured. Some of these things, the health facility may decide to have an administrative fee that covers those little costs. Yeah. But all in all, the cost for the services, both the treatment, the testing and the treatment are free. But those other administrative fees may actually be at the discretion of the facilities to see what are the resources they are making, how do they cover for these other costs, and then they come up with something that is as subsidized as possible, that does not deter people from accessing services from the health facilities. So Farm Chris does not do the whole something, but those targeted interventions, making the commodities free, is what we are covering.
Okay, for how long would this last? You say you started
for an initial period of 2 years. So for now we will be supporting the FCT malaria elimination program for 2 years. So we started in November last year, and we run through October 2026.
Yes. Okay, so for now, malaria is free. If you have this malaria, please try to avoid getting malaria. But if you have malaria and you're in the Federal Capital Territory, Abuja, then all the health facilities are supposed to have this, the public ones, right? Public health facilities, not the private ones. They are supposed to give you testing and treatment for free. We'll be back after this break, and we'll now talk some things a bit more global about healthcare and even malaria. Why are we talking about elimination and not eradication? We'll be right back.
In a world filled with impactful stories and transformative experiences, the essence of change is vital. That's where we come in. With over 16 years of experience shooting documentaries, we specialize in productions for local and international non-governmental organizations. Our focus is on showcasing the results and impacts of non-profit intervention on individuals, institutions, and society. We capture the success stories that emerge from these interventions, allowing project management experts to focus on designing projects with the greatest value to the beneficiaries. Our skilled team of filmmakers, storytellers, and technicians serve as a powerful tool, raising awareness, fostering empathy, and mobilizing support for the cause that truly matters. If you are a non-governmental organization looking to amplify your impact through compelling storytelling, let us bring your success story to life, ensuring that the world hear the voices that deserves to be heard.
Connect with us by sending an email to info@isumedia.net.ng for more interesting updates. Follow us on our social media platforms @ISUMedia. ISU Media, ocean of ideas.
All right, welcome back. Thank you for being with us on Akweya TV. If you are watching us on YouTube, well, just share to your colleague. Today is World Malaria Day. Share this instead of sharing malaria parasite. And if you're watching us on other platform, hop onto www.akweyatv.com or onto youtube.com/@akweyatv. You can engage with our content. I'll come back to the guests we have from FarmChris Healthcare Initiative. The issue of elimination and eradication. Nigeria is having the National Malaria Elimination Program. And then people have asked the question, elimination, why didn't you do like the polio eradication program? What's the difference for those who do not know?
Okay, I think it's just a terminology thing. So look at it this way. For us to say malaria is eradicated, it has to be at the global level.
Okay.
So you can only use eradication when you're talking about global elimination. So elimination is at a localized level.
Okay.
That locality can be the nation.
Yeah.
It could be a state. So for instance, in Nigeria, Lagos can achieve elimination, while the other states are in control phase, right? So you use the terminology elimination when you're talking about a localized setting. So when compared to the world now, we can only achieve elimination in Nigeria.
Okay.
But then you can now say the world has achieved eradication when there is no malaria anywhere in the world, just as it was for smallpox. Smallpox was eradicated completely, right? So we can't say any country has.
Guinea worm was eradicated too, right? Guinea worm.
Guinea worm. Well, I'm not too sure, but I'm not too sure. But I think I know of smallpox. So it's just the difference in terminology. Elimination is for a locality, which could be a nation, a state. Then eradication applies to the global unit.
But if Nigeria has 27% of the global burden of this disease, why is this not heading towards elimination? If you're controlling within Nigeria, is it not almost like an easy work for eradication globally?
Yeah, so that's why that is an unenviable position that we carry, right? One of those places where you don't like to be the first, but then it is also another reason why it is hard for the world to achieve eradication. Because if a country that contributes a quarter of the burden has not been able to successfully eliminate, then you will see that at the global level, you will struggle with eradication, right? So a lot of effort needs to happen in Nigeria, because what happens in Nigeria will have a significant role in what happens globally, right? So that's just where we find ourselves currently.
Yeah. And Nigeria has this unenviable position in vaccination, immunization. We have very low immunization rates, and children out of school, or even general out of school children. Why do you think, is it that we talk too much and do too little? You think we're talking too much and doing too little? Because, I mean, today is World Malaria Day, and it's good to understand that, okay, are we just doing a campaign, then we just go back and sleep? As a people, is that the challenge we're having?
I think, first of all, I would look at it as a function of our population, because we're a lot. So whatever it is, percentages that would apply to us would also be on the high side. So I do not see that we are talking too much and doing too little, but I feel that we are getting there. It's not something that would happen today, tomorrow, but efforts are being made and we'll gradually get there. So if I'm to talk about malaria, for instance, in 2010, the prevalence was about 42% for Nigeria. And for a decade now, coming to like about 2021, we dropped to 27% or thereabouts.
22%.
22, yeah, actually about 22, about 22% now. So you can see that there has been like a progress from then to now.
Those kind of fake progress in percentage, because if you look at the absolute numbers of 40% then, with a larger population now at 22%, because if then population was around 160 million thereabouts, and now we're at 225 million.
Yes.
If you do a 40% of that,
it would be lower.
40%.
The absolute numbers would be lower.
The absolute numbers are quite high now.
It's high now. It would have been lower then. Yeah, that's why I first said it's a function of our population. So we're not quick to see the results, but we'll get there. Rome was not built in a day. I think last year, Egypt was certified malaria-free. So it's a gradual process. We'll eventually get there, because that's where we are aiming. To see a day where Nigeria will be certified malaria-free. But
you are, at least you are the CSO component of the national response, right? I would say, I mean, because you are also contributing to the national response. If our goal is elimination, what would you say if someone is saying that Nigeria, because elimination is supposed to make it less of a public health concern, but it's still a big, in 2021, we had 190,000 people that died of malaria in 1 year. In the same year, I mean, about the same year where we are spending a lot on COVID-19, we had people dying from one disease, 190,000, and COVID for 3 years, 3,000. Don't you think we have a misplaced priority in terms of how we prioritize this malaria thing?
Well, I wouldn't say a misplaced priority. I would just say that the normal Nigerian have come to accept malaria as a norm.
But it's killing us, 190,000 per year.
And they do. That's the painful part, because we accept it like malaria is a norm. We have not attached the seriousness that malaria deserves. So even when malaria kills, people do not even see it like it's malaria that killed. Right? So you have a child who had severe malaria in the community and was convulsing and was rushed to the health facility. And the medics did their test. It was severe malaria. They were managing, and the child died. What goes back to the community is not that the child died of malaria. Is that the child died of convulsion. Right? So you see that even though that child had malaria, they did not understand the gravity of this malaria that the child had. Because they have we are now so much used. We have commonized malaria. So it is not that there is no priority from the government to address malaria, right?
No, I think there is no priority because you said earlier, okay, and then you are providing that testing. So how does a person say that child died of malaria when the only thing that they can confirm is there was convulsion? That was a symptom they saw. There was no other way to test. You know, because where are the testing facilities in these communities that can actually help us identify that, no, that wasn't just convulsion?
So you see that in science things evolve, right? So there was a time, I know when I was in medical school, it was very okay to do what we call clinical diagnosis of malaria. So as a clinician, I can see a child and I put the symptoms together. I say, I suspect this is malaria. I go ahead and treat without confirming. So over the years, evidence-based medicine has evolved, and we are now saying, no, do not treat someone unless it is confirmed that there's malaria. So over the years, testing became an integral component. In fact, the first component of malaria case management. You should test before you treat. So you see that as things are changing, sadly, people are not changing with these things. So you may go to health facilities today, and you may see that some medical doctors or healthcare workers are still doing the clinical diagnosis, which is no longer recommended as per the national guidelines for diagnosis and treatment of malaria. So you see that instead of them to have tested, they go ahead to treat. Sometimes it is not the fact, it's not that they don't know what to do. It could just be that they do not have those commodities at the time to test, and they run ahead to treat. But you see, there are many factors that may, account for why we do what we do. But the truth is that it's not like there is a deprioritization. It's the fact that the people who should, everyone, like I said from the beginning, we all have our own roles to play. Assuming you, who is enlightened, and you know that you should be tested for malaria. If you have fever, you should be tested for malaria before you are treated. If you go to the health facility and you see a healthcare worker who is saying, go and take malaria medicine, what would be your first response? Me personally, I would request for a test. Why are you treating me blanketly for malaria? Please, can you do a test for me?
They'll tell you it's endemic. There were so many cases that came in the last 1 week.
Thank you. So you see, the other component I'm trying to say now, that so we need to evolve with the new knowledge that is happening. So it could be that from the healthcare workers' experience, they are unaware of the current guidelines. So they are still fixated on their clinical diagnosis knowledge that they graduated with. So as these things have changed, there's need for, training of these health workers to flow with the tides, right? And also as community members too, we need to also be sensitized. So if I know what I'm going to get from the facility, when you are not giving me that, I can question it. So I demand accountability.
So are you also including training of health workers in this provision?
Yeah, it's a massive component of the FAMCRIS Healthcare Initiative support to the malaria elimination program. A massive component. We'll be doing lots of capacity building for health workers, even down to the community level.
Community level, there are sensitization sessions that would, enlighten people, provide the needed knowledge. So if you go, even if the health worker doesn't know, you are at liberty to say, okay, I want to test before any treatment. And it's also part of our key messages that will be given to the community members.
All right. So it's been, quite an interesting time. Before we leave, I would say you should tell us something before we go. World Malaria Day, Chinyere Okolo, what do you have to say?
For this year's World Malaria Day, we encourage everybody to be committed. Zero malaria starts with you and me. So let's take action. There is only so much that we can do for you. Everybody has to come together. It is our collective efforts that will eventually eliminate malaria.
All right.
Thank you.
Thank you. Dr. Austin Firima.
Okay, for me, just a simple key message. Not all fevers are malaria. When you have a fever, go to the nearest health facility, get tested, demand to be tested. And then if the outcome is positive, then treatment can now happen. So we as community members, we need to demand that accountability from the healthcare providers. And that's the only way that we can jointly fight this malaria burden.
All right.
And if you're a pregnant woman, there are preventive medicine for you and your unborn child. So please head to the nearest public health facility, get tested, and get those services. Thank you.
All right. Thank you very much, Dr. Firima and Chinyere, for being here from FAMCRIS Healthcare Initiative on World Malaria Day. There is a lot you can do yourself as a community member, and you've heard from the experts in the field. Do share this message and let others know, because it's not supposed to just hang with you. 1/4 of the global burden of this disease, malaria, is coming from Nigeria, just one country out of over 200 countries, and it's not a good thing. So please share this message and then leave a comment if you're watching us on YouTube, and then we'll get back to you. Thank you so much for being with us for this about half an hour. My name is still Odo Diego Kenyodo, and I'll see you another time.
Thank you.